Hi everyone, this is Linda and La Delicia de Linda, and today we're going to do a special series, and I'm hoping this will be the first of a very long series, which will be on trigeminal neuralgia, or just in general, neuralgia, and answering your Q&As about this condition since I've been suffering with specifically atypical auriculotemporal neuralgia on the right side of my head. Now, one of my disabilities is cognitive memory issues, so I can't really pinpoint exactly the year it started. My best guess would be around post 2016, because I do remember 2016 was the year where just my health just kind of derailed. More likely, probably 2018, but I've suffered neuralgia for several years now, and it's been quite a long journey. I'm not a doctor, but I feel like it would be helpful for me to share my experience with you guys or anyone who's interested or have loved ones who have neuralgia, or even if you have or are suffering neuralgia yourself and you're trying to find answers. So just quickly, if you do believe you have trigeminal neuralgia or neuralgia of some sort, the first thing that a doctor would probably recommend for you is a Fiesta MRI. Just a quick lowdown, a Fiesta MRI is not exactly what it sounds like. It's just basically a very high definition imaging MRI. I believe it's one of the most clearest ways you can see if there is a vascular compression on a nerve. Again, I'm not a doctor, so don't quote me on that. But from my understanding, my experience, and my personal research is that go to your neurologist, go to your specialist, ask for a Fiesta MRI, and that is usually the first step to getting diagnosed. Now, again, I'm not a doctor, so just a disclaimer, always talk to your doctor for advice, treatment, and resources. Again, I'm not qualified to get advice. I'm just somebody who's suffered years of neuralgia. I'm still battling it, but I think I've reached a place where, for the most part, I've learned tools and things I can do to kind of manage and cope with it. This is unfortunately a condition that's chronic. I don't think it'll ever go away. For some people, it does go away, but it's very rare from what I've read. With that being said, I just want to begin quickly and explain what neuralgia is specifically. So neuralgia is just a general term to say nerve damage or a condition that's categorized by or characteristic of nerve damage. For example, when people have long-term shingles, that can slowly wear down on the nerves. It can break down the myelin sheath and it can cause all sorts of pain regarding the nerves and its distribution. Now, again, I'm not a doctor or scientist, so I'm just saying this out of my own memory. Now, specifically when it comes to trigeminal neuralgia is nerve pain along the trigeminal nerves. So the trigeminal nerve is located right around behind the ear bone, I believe. As you can see from this diagram, at least it looks like it's right behind the ear bone. Don't quote me on that, but yeah, just look at the diagram. You can see the base of the trigeminal nerve. It is situated kind of in the middle, and then it branches out into three major branches. Sometimes those three major branches are called V1, V2, V3. So that means the pain can shoot from the trigeminal nerve outwards to any or all of the three branches. So for me, a lot of my pain was situated on the top two branches. The bottom branch hits the mandibular, and fortunately, I didn't really have pain so much there, but the mandibular part is where most people get their trigeminal pain. Okay, so now moving forward, there's usually two types of neuralgia. There's something called atypical neuralgia and atypical neuralgia. Now, typical neuralgia is more like intermittent pain, zapping, zinging, almost like electrical shooting pain, whereas atypical, if I haven't said it right, atypical is usually categorized as type 2 and atypical is type 1. So type 2, the atypical type, was the one that I had, and atypical neuralgia is still nerve pain, nerve damage, but it's more of a dull, constant, never going away kind of pain. Sometimes it's called intractable pain, meaning it just doesn't go away. You can take a bunch of medications, painkillers, lidocaine, trigger point treatments, also sometimes called as nerve blocks. You name it, it's still there for the most part, but it just can be kind of dulled down a little. So it's kind of like pick and choose your poison. Do you want a constant pain that's a little bit dull, or do you want excruciating, like, oh my God, what the hell just happened? Got shot by a lightning bolt, intermittent pain? Unfortunately, as time goes on, some people also end up developing both type 1 and type 2. So it's really aptly described as the suicide disease, and I don't want to scare anyone, but it's nicknamed the suicide disease because the pain is so excruciating that most people can't stand it and don't really want to live with it. Again, if you're having suicide ideation, go see your psychiatrist, go see your therapist, your psychologist, your counselor, go call 911, whatever you have to do. But suicide is not the answer. There are treatment options for trigeminal neuralgia. You just have to find the right one to help you. And unfortunately, like I said, the sad part is sometimes you can see all the best doctors and still have to manage the pain for life. So to close up this video, I just want to give a brief overview. Trigeminal neuralgia is often characterized by stabbing, shooting, shocking, or even constant dull digging pain. Go see your neurologist to get treated, to get diagnosed. You might need to ask for a Fiesta MRI test to diagnose trigeminal neuralgia. An alternative to also diagnosing would be to take a medication called Trileptal or Tegretol. Those are two medications that are aimed specifically at trigeminal neuralgia. And if you respond to that, that's usually another way that a doctor may diagnose you with trigeminal neuralgia. There's just too much to cover in one video, so unfortunately I have to end it here. In my next video, I'm going to answer your Q&A questions. I had a few Q&A questions, and like I said, there's just so much information to unpack, and I hope these videos do help someone out there. I may not be able to answer all your questions, but I'll do my best to make videos giving you the information that I have learned and that I found useful. And ultimately, I came up with this idea with a series because I have been receiving questions about my decompression surgery. Just an FYI, I didn't go MVD. I had a auriculotemporal and zygomatic nerve decompression and excision surgery. Those are mostly surface nerves. They don't actually go behind the skull, which is what an MVD would do. So what I did get was a lesser invasive option. It's more like peripheral nerve pain surgery, not actual trigeminal nerve surgery. I'll just end it here. I hope this video was useful. If you found it useful or if you enjoyed this, please give it a big like, comment down below, subscribe to this channel if you haven't already, and to, of course, see new videos on this series. Just let me know in the comment sections your questions, thumbs up, share this video, and the more feedback I get and the more views I get, the more I know that this video is indeed helpful and it would motivate me to continue this series. So again, I hope this was helpful. Thank you so much for watching. Take care. Bye-bye.